Want to bring in Dr. Jeff Potoff from UW Health. We always appreciate your insight, Doctor. Thanks for being with us. And I want to get right to it. So some hospital systems are requiring their workers to get vaccinated. Why do you think UW is not doing that?
You know, up until Delta variant, we thought we were doing pretty good with 90% vaccination. But with Delta variant being so much more contagious, that's a decision that we're reevaluating right now to figure out, should we be doing more?
And when you say 90% for UW, you know, we've heard anecdotally about how many hospital workers aren't vaccinated. What are you hearing overall?
Yeah, you know, it really depends on where that hospital is located. You know, here at UW Health, 9 out of 10 of our employees are vaccinated. You know, in other health systems, especially those in the South, you'll hear much lower numbers, 70%, something like that. So it varies based on which hospital system you're talking about.
And for the people who aren't, do you know their reasoning?
You know, a lot of them will cite safety, personal exemptions, some religious, but we do try to talk to those folks who aren't vaccinated to try to understand that and impress upon them the need to be vaccinated if we're going to take care of the sickest of the sick in our state.
And throughout this pandemic, you know, it seems like we haven't been overly concerned about our kids, saying they might not spread it as much, they might not get as sick, but we're starting to hear of some very sick kids with COVID right now. What are you seeing?
You know, this is worrisome. We haven't been living with Delta long enough where we have robust research studies showing impact on kids. But, you know, there are some studies out there. There's a group in England that looked at, you know, positive tests. They found a 5 times higher rate of positivity with kids between the age of 5 and 24. We're hearing anecdotal stories from places like Missouri where they're having more kids than they expect in the ICUs. And we certainly know kids are susceptible to long COVID. They're susceptible to multi-system inflammatory syndrome secondary to COVID. So we just can't look at kids who die from COVID as the only metric as to whether or not we should be worried about our kids contracting COVID.
You know, the state fair starts on Thursday. We know we have Summerfest after that. Should we be reevaluating going to these big events? Obviously, we saw people packing the Deer District as well.
Yeah, you know, if you're unvaccinated, I don't think an event like Summerfest or the State Fair, where you're going to be close to other people, is likely a safe environment for you. At a minimum, you'd have to be masked. But even with that, you know, I'm just not sure. For those that are vaccinated, you know, being masked, being outside, being mindful of how close you are to other people, there's probably a way to do that safely. But you know, things are changing with Delta variant. It's so much more contagious. It behooves all of us to just take a little bit more caution, think about what we're doing as these numbers are creeping up.
And last question for you, Doctor. You know, we seem to keep hearing about breakthrough cases, and I wonder if that's just because when you announce it, you know, we're not hearing about the people who are vaccinated who are not getting COVID. How concerned do we need to be about these breakthrough cases in Wisconsin?
You know, I think we need to keep an eye on it in the sense that we really want to understand in the vaccinated how often are breakthrough cases happening. The current literature suggests it could happen 10, 12% of the time. If you take 10% of those who are fully vaccinated, that is a large number of folks who could have breakthrough cases. Obviously, the good news being we don't really see them getting very sick. They certainly don't end up in the hospital. So that's the good news, but something to keep an eye on.
Okay, Dr. Potoff, always good to see you. Thank you.